Hello everyone, my name is Ahmed Mirza. I'm a family nurse practitioner, and today I'd like to talk about 6 different jobs that a family nurse practitioner could do. So just a little bit of background, a family nurse practitioner is a nurse that has obtained either their master's degree or a doctorate in nursing and is able to diagnose and treat patients, prescribe medication. They work both in the hospital and outside in the clinic. Number 1 is a little bit obvious, and it's family practice. So as a family practice nurse practitioner, you're considered a primary care provider in most states. You'll see patients of all ages, anywhere from newborn and on, and you'll act as their primary care provider. So patients will come in, you can do yearly physicals, or for pediatrics, you can do well child checks. You'll see them when they're sick, you'll see them when they're well. You can do common procedures, you can do laceration repairs, incision and draining of abscesses. Oftentimes you can be trained, learn how to put in birth control implants in the arms or IUDs. You'll manage chronic illnesses like diabetes, high blood pressure, thyroid conditions, anemia, and many other chronic illnesses. You also have the ability to refer your patients to specialists if they need higher specialty care. A typical schedule for a family nurse practitioner is working from 8 to 5 Monday through Friday, and you usually work no holidays and weekends. Number 2, pediatrics. Similar to family practice, but you only see pediatrics anywhere from newborn to the age of 18 or 19. You oftentimes see them right after they were born and stay with them until they turn 19 years old. You do their well child checks, you see them when they're sick. You also manage their chronic illnesses if they do have any, but a lot of it is well child checks and acute illnesses like ear infections, sore throat, cough and cold, belly pain. In pediatrics, you also can do some minor procedures like wart removals, lacerations, and IUD of abscesses as well. As a family nurse practitioner, you have plenty of training in pediatrics, so you'll be well equipped to be a primary care provider for pediatric. An outpatient primary care pediatric provider schedule is usually 8 to 5 Monday through Friday, no holidays and no weekends. Number 3, you can work at an urgent care. So in the urgent care, you treat patients of all ages. You only typically see acute issues. So you'll have patients coming in with cough and cold symptoms, belly pain, shortness of breath, broken bones. You do a lot of procedures. You do a lot of laceration repairs. You see a lot of abscesses. Typically, most urgent cares have x-ray available on site. So if you have a patient with pain to either arm or leg, you can obtain an x-ray, see the results right away, splint it and taking care of it right then and there, and then refer them to an orthopedic doctor. Most of the acute illnesses that we see in the urgent care are minor. If patient requires an emergency evaluation, then they have to be referred to the emergency department. Urgent care is similar to the acute illnesses that you'll see in a family practice clinic, but the difference is you only see acute illnesses when the patient cannot see the primary care provider, and you can also do x-ray on site. Or a lot of these patients don't have a primary care provider, so you end up seeing them. Almost on a daily basis, you'll see a patient in the urgent care that is severely sick and requires to be evaluated in the emergency department, and you have to be that deciding factor of whether that patient can be treated here in the urgent care or if they need higher care and to go to the emergency department. Urgent care schedule varies greatly. Most of the time they're open 7 days a week, 365 days a year. Many times you work 10 or 12-hour shifts and late into the evening to about 9 or 8 p.m. Number 4, a family nurse practitioner can work any outpatient specialty medical clinic. This can be cardiology, pulmonology, urology, nephrology, basically any adult or pediatric specialty. Usually you'll get on-the-job training and you'll work with a supervising physician. There's a difference between inpatient specialty care, meaning patients that are in the hospital that are staying the night and admitted, and outpatient specialty. The patients that you see in an outpatient clinic are very stable, have chronic illnesses or maybe new illnesses, but they are in general stable and can be managed in a clinic. Versus specialty care inpatient, usually these are patients that are acutely ill, sometimes unstable, and being treated inside a hospital. This area requires an acute care nurse practitioner certification, and as a family nurse practitioner in general, you won't be taking care of those kind of patients. Number 5 is post-acute care. Post-acute care means a skilled nursing facility, a nursing home, or a skilled rehab facility. So as a family nurse practitioner, you could work in a post-acute care facility. You'll, in general, will be the primary care provider. You'll take care of majority of their chronic illnesses. You could also refer out to specialists if needed. You'll also deal with their acute illnesses if they got sick while they're in their nursing home. If they're really sick, decide whether they need to go into the hospital or if you can just treat them there. And you'll see these patients at a very regular basis. You'll build really good relationships with them. The schedule for post-acute care can vary, but a lot of times you can set your own schedule. Usually you have a set amount of patients you need to see per day, but you can go in at any time during the day and see them and leave. Number 6 is emergency department. As a family nurse practitioner, you're in a unique position to see patients in the emergency department because most emergency departments see patients of all ages, so they want a family nurse practitioner to work in the emergency department. This typically requires extra on-the-job training to be well equipped to work in the emergency department, or you can get a postmaster certificate in emergency medicine or do a 1-year fellowship in emergency medicine. In the emergency department, you'll see patients with a wide range of acute illnesses ranging from very minor cold-like symptoms to severely unstable emergencies. What's unique in the emergency department is you usually have multiple providers working at a time. You collaborate together. You see patients that you're comfortable with. So the way it works is when a patient comes and checks in, they're put on the board and there'll be several patients. So as a provider, you can look and say, hey, this patient just checked in. Do I feel comfortable treating them? If you think yes, then you can go ahead and sign up for the patient and be their primary care provider in the emergency department. In most ERs at your work, you'll have emergency physicians available, so if you need to consult or ask any questions. You do a lot of procedures, you have a lot of fractures, patient has a dislocated shoulder or other extremity, you can do a reduction. You see a lot of lacerations, you do a lot of stitches, you do a lot of abscesses, you do foreign body removals of the eye, foreign body of the ear. Sometimes kids stick unusual objects in their ears or nose, and in the ER, you can go ahead and try to remove those. You deal with a lot of patients that are in pain, a lot of abdominal pain, a lot of chest pain, heart attacks, pneumonia. You see a lot of appendicitis. In the ER, you see the patient, you figure out what orders you need to do. You can order blood work, give them medicine, give them antibiotics, pain medication. You can order imaging like x-rays, ultrasounds, or CT scans, and then you're able to see in real time what the results are and make up your diagnosis and treatment plan. From the emergency department, oftentimes, if needed, you can consult with a specialist over the phone to help you manage a patient. If you feel that the patient needs to be admitted to stay in the hospital, you will contact the hospital's doctor or medical provider to get them admitted. Sometimes patients need to be transferred to another facility, so you'll also arrange all that. But as you can see, there are many different jobs that you can do as a family nurse practitioner, and that's what's unique about being a family nurse practitioner. You're very marketable. You have a wide range of skills and abilities that you can do. You can work in the ER, you can work in the urgent care, you can work in the family practice, pediatrics, urgent care, outpatient specialty, and that's why it's such an attractive field. Well, I hope you enjoyed this video. Please give it a big thumbs up and subscribe for more content in the future. Bye.